I feel like Snohomish is pretty darn healthy for the most part, and most people are pretty conscious of eating organically and making sure that they're exercising and wanting to do better for themselves.
Welcome, everybody. We are having another lovely guest on the podcast this afternoon, a Dr. Theresa Martez, who is a local practitioner here in town. Welcome, Dr. Martez.
Thank you.
Oh, and I would like to say, having looked at your website, you have quite a bit to offer and talk about. So to start with, why don't you tell everybody where they can find you and your practices?
So my practice is in downtown Snohomish in the historic district, right off of First and Cedar. And we've been there for almost 5 years. I started off with Dr. Stacy Bowker over near the Fred Meyer, where that is right now. And we were there for about 10 years. And so I purchased the building over on Cedar Avenue where we practice now. And so turned it into a medical clinic. It used to be Crepe Escape. So it was a crepe shop. Some of the people so some people who come by are really mystified that this is not the crepe shop anymore. But yeah, I turned it into a medical clinic. And so I've been practicing for almost 15 years. Yeah, we have a lot to offer at our clinic. So I started Cedar Avenue Integrative Medicine, and so we have several other practitioners that practice inside the clinic. They are their own businesses, and so we've got Dr. Stacy Bowker. I've been practicing with her for almost 15 years. She is a pediatrician, and so she sees lots of families and kids. We've got Dr. Oldenkamp, and she sees lots of different chronic disease conditions. We've got Dr. Jennifer Reed, and she is a naturopath and also an acupuncturist, and so we offer acupuncture services. We've got Charlene Van Horn. She is our acupuncturist, and we actually have 2 brand new naturopathic physicians who have started, and one is a pediatrician and one is a general practitioner. So they are definitely interested in seeing lots of new patients. Actually, half of my practice is massage therapy. I've been doing massage for over 20 years, and so I find that I still love to do massage therapy. I probably don't have to be doing that as part of my practice, but I still love it, and I feel like I help people quite a bit with that.
You know, when you talk about, I think, naturopathic medicine, there isn't a lot, I don't think a lot of people are familiar with what that term actually means. So if you can explain that, might open up a little bit more for people's awareness.
Oh, that is a huge thing for me to even try to explain. So, I mean, I can tell you, so I went to Bastyr University, which is in Kenmore, and it is a very well-known, renowned school for naturopathic medicine. There are only several schools in the entire U.S. I think there's 3 schools in the whole U.S. that teach naturopathic medicine. And so the first 2 years of it are very similar to what medical students learn at UW, because we have to know the basics. We have to know our biochemistry and our anatomy, and work with the cadaver for a whole year. And we have all of the same classes. And after 2 years, we start to kind of branch off and learn more about herbal therapies, homeopathy, nutritional deficiencies, counseling. I'm trying to think of all the different, we kind of learn all of the different specialties regarding the body. But I think that's what puts us apart from other medical doctors, is that we have the knowledge and the expertise in herbal medicine, nutrients, food, exercise, lifestyle management, when a lot of those things aren't typically discussed at most mainstream medical appointments.
They are not.
Yeah, they are not. So we have been trained to specially talk about those things because we feel that those things are extremely important when getting to know our patients and knowing what our patients need to be able to do to make healthier changes and choices in their life. It's not just about taking a prescription. So, you know, we try to encompass all of those different categories as naturopathic physicians, and look at the body and the person as a whole person and not try to group everyone together in one little box. So getting to know our patients really well, spending more time with our patients is really important. And ultimately trying to treat people naturally first. That should be our first goal with any patient. Sometimes it doesn't work out that way, and that's okay. But theoretically, that is our first goal.
So when someone comes in and says, I am on all these medications, I don't know what to do anymore, I'm not feeling like I'm getting better, how do you navigate that?
Well, personally, I probably would do a lot of lab work to figure out where they're at. I would definitely want to talk to them about which medications are working for them, which ones are not. Making sure that the medications that they're on are even properly prescribed, and, you know, working for them in a way that's helping their health. Potentially finding something, maybe they don't need to be taking something. So figuring out if that's something that needs to be eliminated. But I really would look very closely at their diet, their exercise, their quality of life, asking them what is important to them about their life, and really looking at the mental, emotional, physical aspect and asking them what they're willing to do to make some changes.
Wow, that's really good. That's got to comfort people, knowing that it's interactive, that you want to know what they have to say. I think a lot of times people feel like they go to a doctor and they get, if they're lucky, 15 minutes of the doctor's time and little to no information. So some of the things that you treat in your naturopathic, for instance, the anxiety that everybody's having, or you know, the lack of being able to move freely, the fears. How can you help with that?
Well, I've been dealing with that with patients quite a lot. I've been working through this whole COVID pandemic, so I've been trying to help people navigate through this because I don't care who you are, everybody has feelings about this whole thing. Everybody has frustrations and anxieties, and it's hard to figure out how to navigate through this when we've never done it before. And so sometimes just listening to people, sometimes we have to go more in depth, and that means maybe they need some nutritional supplements to help their stress and help their anxiety. Sometimes we talk about breathing techniques. And so I have several things that I can refer for that, and just teaching people how to breathe is a huge thing. And, you know, making sure that if they need more than that, that they set up appointments with a really good therapist or a counselor.
And within your umbrella, the referral is that because they are their own practice, their own business, but within the building, is that something that tends to work out well for a client, so they're not, you know, having to go all over the place for two or three different things?
Yeah.
Is that a good mix for?
I think it is for our patients because, you know, when they come and see me, they can get an annual physical, they can get their blood draw, they can get a pap smear, they can get an IUD inserted, but they can also see me for massage therapy. and they can probably take their kids to Dr. Bowker to be seen, or they can get some acupuncture from Charlene Van Horn or Dr. Reed. And so a lot of our patients kind of find that they can get a bunch of different modalities at our clinic, instead of having to go, you know, this place for here and this place for this and this place for that. So
the pediatric doctor, does that encompass, you know, the basic childhood, oh, I fell off the tree and I broke my arm? Or is that literally a whole different ballgame?
That's a good question, because that would basically entail very acute care, right?
Yeah.
So, and I don't want to make a mistake here. I also see children, but Dr. Bowker specializes more in children and families. So, you know, she already has good relationships with these patients. And so the first thing that the parents would do is call her and say, hey, this is what happened and what should we do now? And she can kind of take them through and triage and figure out what needs to happen next, you know, whether or not they need to go get an x-ray, or whether or not it's something a little more simple. They can bring their child in and she can see them and she can give recommendations. But we are not an acute care clinic where we can put a cast on a child or do x-rays or anything like that. So it just kind of depends, but we can definitely talk them through what needs to happen next.
And that must be pretty comforting to, you know, the people that come into the clinic. They can just call and kind of figure out, well, he bumped his head. What do I do?
Exactly.
You know, is it concussion? Is it, well, that's really quite nice.
Yes. I mean, we are primary care physicians. And so, you know, we basically encompass the whole medical care that someone would need, other than acute care or specialty care, whether that be needing a colonoscopy or needing some kind of diagnostic. We refer people to specialists for that. But as primary care specialists, you know, we look at the whole picture. Like I said, we do pap smears and annual well child checks, which are really important. And we also have all of the childhood vaccines available at our clinic. And every family is different. We do not force vaccines upon people. We have lots of conversations and try to educate our patients on the benefits of vaccines. And so we feel that that is really important. And so we have those available for all children up to age 18.
That is lovely. That's a big topic right now. It's kind of it's kind of a hot spot for people, and to have that availability to call and or see a physician and talk about it, that's pretty huge.
Yeah.
That is very cool for a family practice, kind of a, you know, the all over umbrella. Some of the things that you mentioned that you see people for, the anxiety, thyroid. If someone came in for weight loss or were having trouble, how do you pinpoint what would be kind of the protocol for someone who might think, well, I'm having a food issue, but I don't know what?
Well, that's a great question. So as a doctor, I like to make sure that I look at all of the different aspects of someone's health that may be contributing to weight gain or the inability for them to lose weight. So it can be looking at lab work, which would tell me, you know, if they had a thyroid condition, which might be impeding that, or maybe they've got some nutritional deficiencies.
Someone's afraid to try a new doctor or try a new place.
Yeah.
Just from the sounds of how you have set this up, it just seems like it would be far more comfortable to walk into.
Yeah, and that's really what I wanted to do when I created my clinic. Was when you walk in, I've got a fireplace, and it's just comfy and cozy, and most people just feel comfortable when just even walking through the door. It's not a sterile doctor's office that you would think of.
So is that your personality?
I would like to think so with my patients. I'm pretty relaxed with my patients, and you know, just try to spend a lot of time with them, and just trying to make them feel comfortable, trying to make it seem like I'm not judging them for anything that they're talking about.
Nice.
And yeah, just trying to make them feel welcome with us, because I do appreciate the fact that they have chosen naturopathic medicine and chosen me as their doctor. I think that's a privilege. So
That's wonderful. I'm also now thinking of, just because of how comfortable and welcoming it sounds, how about the, our aging group of people that have spent a lifetime in the medical association that is very, here we are, we're doing this, blah, blah, blah. And now this might feel a little more welcoming. Do you have someone that specializes in the geriatric versions of things that are needed?
I wouldn't say that any of us necessarily specialize in geriatric medicine. It is a little tougher to get the older population into our clinic because Medicare does not cover naturopathic medicine.
Oh, bummer.
So most people who are above the age of 65, 66 are on Medicare. And so they don't have, typically, a lot of extra money to spend out of pocket to see us. And so, I have, a sliding scale that I offer some patients, and I have, decreased prices for people that see me out of pocket. And so I try to be very conscious of that for, the older population. I do have, with that being said, I definitely have people over the age of 65, and sometimes we figure out ways to work around Medicare, or I will ask them to ask their physician, can you order these labs for me so that they'll be covered for this patient? And a lot of times if I set up that relationship with their PCP, they're more than happy to order the labs that I want. So
I guess in a perfect world, that would all go smoothly. Is it really that? Because I know in an age bracket, things can become very fearful, and it's easy to be afraid of any change. So is that really as easy as you're making it sound? Like someone could feel very comfortable in having that help out of your clinic?
Yeah, that's a great question too, because I think you're right in that a lot of people are hesitant because they don't know, like, is this, if we do some kind of woo-woo medicine, because they don't really know what we do.
Right.
So I would say that the patients who are older, who seek us out or seek me out, tend to have a very open mind and have been introduced somehow to some other type of alternative medicine, whether it be acupuncture or Chinese medicine, or stuff like that. So they kind of already know a little bit what they're getting into. But it does become a little more challenging dealing with aging patients because they typically have more conditions to deal with.
Right, and that's true.
Which can be scary too. So.
And it's juggling their care and the medications can be quite difficult.
Yes.
Under your program or your care for nutrition, how specialized can that get? What does that look like for someone that's needing extra care around their level of nutrition? Maybe their body isn't functioning where they're absorbing nutritionally well.
Yeah. I mean, that happens all the time, whether it be with iron or vitamin B12 or folate or, those kinds of things. So I definitely take a look and make sure, and sometimes I use lab work, sometimes I don't. I go with what the patient tells me. We take a look and see what's working for them, what's not, what kind of conditions they have that typically will drain nutrients, and if they're not getting those, then they need them. Like, for example, vitamin D. Most, I'd say 75% of patients I see are deficient in vitamin D, and it just is because we live up here in the Northwest and we just don't get enough sunshine. But vitamin D is vitally important for many processes that happen in the body, and can be extremely important for bone development and mental health, heart health, the immune system. And so, just knowing about how vitamins, nutrients, minerals work, I can figure out how someone might be deficient, or someone might be just fine with that. And lab work does help us figure that out too.
So in that context, in the pediatric world, how do you determine if a very young child, baby, toddler is in that bracket? How do you determine if their nutritional needs are being met for the building of the bones and,
Well, typically kids do just fine in that regard, and they don't need a ton of supplements or minerals. However, if their diet is not good, if they're extremely picky eaters, if they've got signs and symptoms of other things going on, like, for example, maybe they're extremely pale, maybe they've got an iron issue, or they've got some fatigue. But it can get complex, and Dr. Bowker deals with that a little bit more than me, but typically kids do just fine in that regard. Maybe they need, a multivitamin because they're just not getting as many fruits and veggies as they need. Or maybe they need some probiotics because they've been having some stool issues or some tummy issues. But typically it's pretty minimal when it comes to that regard. But there's signs and symptoms and things that we're trained to notice and see that give us clues as to if those things are off or not for kids.
So for a parent, if, I guess this might be a loaded question, I don't know. If a parent were to look at their child and there are a number of things that they're noticing, but they don't know how to put it together, what are some of the simple things that might tell them they would need to come in and have their child seen for deficiencies?
Well, first of all, I definitely would start with well-child checks, and those are annual. Those are meant to pick up, circumstances that may be slightly off, but because parents see children every day, they don't notice them. And so the doctor would notice that. So that could be the first line. Other things might be like either their children aren't sleeping well, or they stop eating most things, or they start eating other things that they shouldn't be eating, like dirt or, things out in the yard. Those are also signs of potential deficiencies. But really parents tend to know pretty well when their child is off just a little bit. And so maybe they won't be able to pinpoint exactly what it is, but having a relationship with their doctor and their doctor seeing their child on a yearly basis or more than that should be a way to be able to pick up on any kind of weird nuances that might be going on.
So let's talk then, we'll move out of the pediatric for a minute. Although it's right now, it just seems to be, especially with COVID, there's just a lot surrounding families, kids, the fears, the schools. But let's like Snohomish residents in general, do you see us as being fairly vibrant? Is the community fairly healthy, do you think? I know that's a very broad question.
Yeah, I mean, I'm always so incredibly pleasantly surprised by the Snohomish community. They have taken naturopathic medicine and embraced it. They have accepted that as a type of medicine here, especially with kids and pediatrics. It's incredible to me. I feel like, and granted, I haven't practiced in any other communities, so I don't have, something else to compare to, but I feel like Snohomish is pretty darn healthy for the most part, and most people are pretty conscious of eating organically and making sure that they're exercising and wanting to do better for themselves. So in that regard, I find that amazing and great. I mean, granted, you will find people who are not like that. They typically don't want to come to see naturopathic medicine specialists for that, because they pretty much know what we're going to ask them to do.
Right.
So yeah, we typically see people who want the help and want to make changes and want to follow our recommendations. So,
and we do have such an abundance of organics and organic farms. It's pretty phenomenal. But it's good to hear that as a physician, you see our community as basically fairly healthy.
Yeah, I do.
That's a nice thing. I think it also quells a little bit of the fears around, especially what we're going through right now, that overall we have a healthy community, we are mindful, we eat well.
Yep.
Is there anyone within the umbrella, the practice, that you would like to speak about or tell the audience more about?
Yeah, actually, someone that I forgot to mention, she is a nurse practitioner in our office, and she just started in January, and she is a functional nurse practitioner. She's working on her doctorate right now, and she specializes in chronic health conditions involving the need for significant weight loss. She herself has been through that, and so she's got a ton of knowledge. She's so super smart. She's got so much to share. I believe she used to work in hospice conditions, and she just was so saddened by seeing so many people dying of these chronic health conditions that she decided she wanted to get on the other end of it and stop it before it made its way towards those, life-ending diseases that she kept seeing over and over. So she works in our clinic. Huh? Oh,
her
sorry.
name?
Her name is Theresa Free. And she typically wants to see people who have chronic health conditions, people who are ready to make a huge change. They just need direction and maybe some hand holding and, just some expertise in maybe managing some of their medications and that kind of thing.
Well, and it sounds like those type of situations need the warmth and care, as you are saying the clinic has, and the availability of different people to work with. So on that note, I think we've probably come to the end of the road. We've talked about a lot, unless of course there's anything else you want to add in.
Other than, you can always go to our website for more information, which is cedaravenuemedicine.com. Or if you wanted information specifically on me, my website is naturopathicadvantage.com. And just give us a call if you have any questions, and, we'll happily figure out how to put you with a practitioner. And
Perfect. Well, thank you for your time and the wonderful information. We so appreciate the effort, because I know, like most people, but maybe more so, you're very busy. So.
Yes. Well, I really appreciate the fact that you are putting this out there and introducing us more to the community. And I mean, it really means a lot.
Hey everybody, if you have enjoyed this video and you've seen some of the others, please give it a like and be sure to subscribe to the channel for future interviews that are coming up, and learn more about the local practitioners you live around and with here in Snohomish. Thanks.